Welcome, Dr. Marder, back to Rheumatology Network. We wanted to talk with you today about Kidney Week, and we're going to do a roundup of some of the presentations that stood out most to you as a nephrologist attending this meeting and someone who does treat patients with gout. So, what were the highlights for you during the meeting?
Thanks, Amy. You know, Kidney Week is a nephrologist's favorite week of the year. And this week, it was a virtual meeting because of the pandemic. But despite the fact that it was virtual, there was some really interesting new research that was presented. What stood out to me is several new emerging therapies that had some clinical trial results regarding lupus nephritis. And this is a topic that is interesting both for rheumatologists and nephrologists because we both take care of this patient population that just suffers so much with this disease that often can impact their lives just tremendously. So Brad Rovin from the Ohio State University actually had a great presentation and presented some emerging trial data, including new agents like belimumab, which is now indicated for lupus nephritis. That looks like addition to belimumab to standard therapy, standard induction therapy, actually improves remission rates in patients with lupus nephritis, and that's very exciting. He also presented a poster regarding a new novel calcineurin inhibitor, voclosporin, which added to standard therapy also improves remission rates to lupus nephritis. And this is actually very important because the European Renal Association uses calcineurin inhibitor as one of the potential treatment choices for induction for lupus nephritis. And so we all know that calcineurin inhibitors have quite a few side effects in their profile. And so having a new agent in that class might really help more patients get successful treatment. And then there is a new therapy, which is a CD20 antagonist, a monoclonal antibody called obinutuzumab that is also enrolling in trials like now, and looks like it may be a very successful therapy with it in addition to a standard therapy for these patients with lupus as well. And so these are very exciting new agents that come at a time when there really hasn't been a whole lot of new therapy options for these patients who are suffering from lupus
Today.
Well, there certainly are a lot of other promising research. There's a good overview of the hypoxia-inducible factor prolyl hydroxylase inhibitors that looks like it may revolutionize the treatment of anemia of chronic kidney disease. There's a lot of progress being made on the SGLT2 inhibitors for diabetic nephropathy, and also patients with other kinds of chronic kidney disease apart from diabetic nephropathy. And there is even some very interesting new compounds like finerenone, which is a selective mineralocorticoid receptor antagonist that looks to also reduce progression of chronic kidney disease in many patients. And, you know, COVID-19 is a very big subject this year. Mm-hmm. And so there was a very interesting poster that was presented from Thalia Salinas at Cornell that compared both hospitalization rates and fatality rates of patients with COVID-19, either patients who were on the kidney transplant waiting list or who already had a kidney transplant. And it turns out that the patients that were still on the waiting list actually had higher hospitalization rates and higher fatality rates than patients that have a kidney transplant that are taking immunosuppression. And so that's very interesting to see that, that even though patients who are on immunosuppression for their transplant actually had lower hospitalization rates and fatality rates than patients who had not yet got their kidney transplant and were not on those therapies.
Right. Well, patients with chronic conditions across the board seem to be more affected by COVID-19,
Well,
whether it be
that's so
diabetes.
true. There's two possibilities here. Either patients with kidney transplants just become so much healthier than patients that were on dialysis that they are not affected by the virus as much. Or there is a potential that the immunosuppression medications that patients take for their transplant may have some benefit to patients in lessening the immunologic reaction that the body has to the viral infection.
hmm Well, interesting. I look forward to learning more about that as well. You know,
Me too.
we learn. Yeah.
So yeah, this was a very interesting Kidney Week. Of course, we would have rather had it in person than had to do it virtually. But still exciting stuff. And I can tell you, as a Denver Bronco fan here in Denver, Colorado, I much preferred watching the Kidney Week presentations yesterday than the Broncos getting their butts kicked by the Kansas City Chiefs in the
Oh,
game
too
yesterday.
bad.
Right.
Okay. Well, timing is everything then. Yeah. Okay. Well, that's good to know. Well, thank you for your time. Thank you for your time today, and we really appreciate your insights on Kidney Week, and we look forward to hearing more from you. You know, as we go on.
It's great to talk to you, Amy. Thanks for inviting me
Okay.
here again.
Thank you. All right. Take care.